The silent strength. Understanding and nurturing women's bone health.
For women, bone health is a cornerstone of lifelong well-being, influencing everything from mobility and posture to overall vitality. While often overlooked in younger years, the unique physiological changes women experience throughout their lives make proactive bone care particularly crucial. Point 2. From adolescence to post-menopause, a complex interplay of hormones, lifestyle factors, and genetics shapes bone density and strength. Understanding these dynamics and adopting bone-healthy habits is essential to prevent fragility and maintain an active, fulfilling life. Point 3. The foundation years. Building peak bone mass. Childhood and adolescence are critical periods for building peak bone mass, the maximum amount of bone tissue an individual will achieve. 4. This foundation serves as a reserve throughout life, influencing the risk of osteoporosis later on. 5. During these years, adequate calcium and vitamin D intake, coupled with regular weight-bearing exercise, are paramount. Point 6. Weight-bearing activities, such as walking, running, jumping, and dancing, stimulate bone formation and increase bone density. Point 7. Ensuring sufficient nutrition, rich in calcium from dairy products, leafy green vegetables, and fortified foods, alongside vitamin D from sunlight exposure and dietary sources or supplements, lays the groundwork for strong bones in adulthood. The childbearing years, hormonal harmony and bone density. During their reproductive years, women benefit from the protective effects of estrogen, a key hormone that plays a vital role in maintaining bone density by slowing down bone breakdown.
8. Pregnancy and breastfeeding bring unique considerations for bone health. While the fetus requires calcium for skeletal development, the mother's body adapts to increase calcium absorption. Point 9. However, some temporary bone loss can occur during breastfeeding as calcium is transferred to the baby. Point 10. Generally, bone density is restored after childbirth or the cessation of breastfeeding. Point 11. Maintaining a calcium-rich diet and ensuring adequate vitamin D levels remain important during these phases.
The transition, perimenopause and menopause, a critical juncture. The menopausal transition marks a significant turning point for women's bone health. As estrogen levels decline dramatically, the rate of bone loss accelerates. 12. This rapid decrease in bone density makes women significantly more susceptible to osteopenia, low bone mass, and osteoporosis, a condition characterized by weak and brittle bones that are prone to fracture. In fact, osteoporosis is about 4 times more common in women than in men, and approximately half of all women over the age of 50 will experience a bone fracture due to osteoporosis. This increased risk underscores the importance of proactive bone health management during and after menopause. Point 13. Risk factors specific to women's bone health. Several factors can further elevate a woman's risk of developing osteoporosis. Hormonal changes. Early menopause, before age 45, prolonged absence of menstrual periods, amenorrhea, or a hysterectomy before age 45, especially with ovary removal, can lead to earlier and more rapid bone loss due to reduced estrogen levels. Point 14. Body size and frame. Slender, thin-boned women often have less bone mass to begin with, making them more vulnerable to bone loss as they age. Point 15. Age. Bone loss is a natural part of aging, and women tend to live longer than men, increasing their cumulative risk. Point 16. Genetics and family history. A family history of osteoporosis or hip fractures can increase an individual's susceptibility. Point 17. Certain medical conditions. Conditions like rheumatoid arthritis, thyroid disorders, celiac disease, and eating disorders can negatively impact bone health. Point 18. Medications. Long-term use of certain medications, such as corticosteroids, Some anticonvulsants, and certain cancer treatments, can contribute to bone loss. 19. Lifestyle factors. Smoking, excessive alcohol consumption, low physical activity, and inadequate intake of calcium and vitamin D can all weaken bones. Strategies for lifelong bone health in women. Adopting a proactive approach to bone health throughout life is crucial for maintaining skeletal strength and preventing fractures. 20. Here are key strategies. 1. Nourish your bones with diet. Calcium intake. Ensure adequate calcium intake through diet. Good sources include dairy products, milk, yogurt, cheese, leafy green vegetables, kale, spinach, collard greens, fortified plant-based milks and juices, tofu, almonds, and canned fish with bones, sardines, salmon. The recommended daily intake varies by age and life stage, generally increasing after age 50 and during periods of increased need like adolescence and lactation. Vitamin D sufficiency. Vitamin D is essential for calcium absorption. 21. Obtain vitamin D through sunlight exposure. With appropriate skin protection, fatty fish, egg yolks, fortified foods, milk, cereals, and consider supplementation if dietary and sun exposure are insufficient. Other essential nutrients. Ensure a balanced diet rich in other bone-supporting nutrients like vitamin K, magnesium, phosphorus, and protein. 2. Embrace weight-bearing exercise. Engage in regular weight-bearing exercises that force your body to work against gravity. 22. This includes activities like walking, jogging, dancing, hiking, stair climbing, and tennis. 23. Incorporate strength training exercises using weights or resistance bands to build muscle strength, which supports bones and improves balance, reducing the risk of falls. 24. 3. Adopt healthy lifestyle habits. Avoid smoking. Smoking significantly impairs bone health and increases the risk of fractures. 25. Moderate alcohol consumption. Excessive alcohol intake can interfere with calcium absorption and bone formation. 26. Maintain a healthy weight. Being underweight increases the risk of bone loss, while being overweight puts excessive stress on joints. Avoid extreme dieting, which can also harm bone health. 27. Practice good posture. Maintaining good posture reduces stress on the spine and can help prevent spinal fractures. 28. 4. Prioritize fall prevention. As women age, the risk of falls increases. 29. Take steps to prevent falls by ensuring a safe home environment, removing tripping hazards, using adequate lighting, wearing appropriate footwear, and addressing any balance or vision issues.
5. Regular bone density screening. Bone density testing, typically using a dual-energy X-ray absorptiometry (DXA) scan, measures bone mineral density. 30. Healthcare providers often recommend screening for women aged 65 and older, and earlier for those with risk factors for osteoporosis. 31. Monitoring bone density over time can help track bone health and the effectiveness of interventions. 32. 6. Consider medical intervention when necessary. If diagnosed with osteopenia or osteoporosis, various medications are available to slow bone loss, increase bone density, and reduce fracture risk. 33. Discuss treatment options with your healthcare provider. Hormone therapy (HT) or estrogen therapy (ET) can be effective in preventing bone loss associated with menopause but carry other risks that need careful consideration with a doctor.
The power of proactive care. Women's bones are dynamic structures that respond to the choices we make throughout our lives. By understanding the unique challenges and opportunities for maintaining bone health at each stage, women can take proactive steps to build and preserve their skeletal strength. Nourishing the body with a bone-friendly diet, engaging in regular exercise, adopting healthy lifestyle habits, and undergoing regular screenings when recommended are all vital components of a lifelong strategy for strong, healthy bones and a future filled with mobility and vitality. 34 Embracing this proactive approach is an investment in a future where women can continue to lead active and independent lives for years to come.